Defense mechanism. Myself, Dr. VAIBHAV CHATURVEDI. I am assistant professor at Department of Psychiatry, Index Medical College, Indore. So, what is defense mechanism? Defense mechanisms are unconscious psychological responses that protect people from feeling of anxiety, threats to self-esteem, and things that they don't want to think about or deal with. First described by Sigmund Freud in his psychoanalytical theory, defense mechanisms function to protect against anxiety. Freud thought we had a specific way to prevent anxiety. He felt these mechanisms were automatic. Most Freudian ideas are now discredited. Defense mechanisms, however, are still quite current. Anna Freud did a lot of work on these things. Those identified by Anna Freud are great. She also identified reversal and turning in children. George Valiant, in his book Adaptation to Life in 1977, described defense mechanisms in four types. Defenses can be grouped hierarchically according to the relative degree of maturity associated with them. They make one hierarchy. All defenses are unconscious, with one exception is suppression. Defenses change over time. We are only aware of our defenses in retrospect. Four cluster of defense mechanisms are narcissistic. The boundary between self and other is highly upgraded. It is usually found in young children and adult dream or fantasies. Immature. Immature defense mechanism arises from anxieties with intimacy or its loss. They are encountered in pre-adolescent years and in adult, especially those affected by personality disorder. Sense of self is stronger with the narcissistic defenses, but the ego has areas of vulnerability. Neurotic, common among individuals with neurotic disorder or well and as normal, healthy appearing individual. Neurotic defenses mechanism elevate distressing effects and may be more socially acceptable, fairly strong and robust sense of self and the ego. These defenses serve to address the unpleasant discomforts of anxieties. Mature, more sophisticated and require more experience and self-awareness. Mature defense mechanisms help approach reality in a more meaningful and social adaptive way. These defenses distort reality. In narcissistic defenses, there is denial, distortion, projection, splitting. So, what do you understand by projection? The person attributes one's own perceived negative attributes onto someone else. For example, Bill blames the instructor for a bad grade when he didn't study. Sam cheats on his spouse and blames the spouse for cheating. What is denial? The person doesn't acknowledge the validity of the matter but acknowledges its presence. They oppose force with force. For example, after surviving a heart attack, a patient insists on continuing his lifestyle as if nothing had happened. Or a smoker conclude that the evidence liking cigarette used to health problem is bogus. Means they don't want to link between smoking and lifestyle change, and they don't want to quit the smoking. What is distortion? Reshapes external reality to suit inner needs, beliefs, hallucinations, delusions, sustained feelings of superiority, entitlement. Example, a student believes she failed an exam because the questions were unfair and not because she didn't prepare properly. Splitting divides external object into all good and all bad, abruptly shift from one extreme to other. Sudden and complete reversal of feeling, self-concept may oscillate. So, what are immature defenses? Acting out, blocking, hypochondriac, identification, introjection, passive aggressive behavior, projection, regression, schizoid fantasy, somatization. So first we will discuss about acting out. Acts an unconscious impulse or affect to avoid affect. Acting gives into the impulse rather than prohibiting it, avoids the tension of postponing expressions, often seen in individuals with borderline or antisocial personality disorder. Examples are instead of just saying, I am very angry with you, the person who act out may throw an object at the person or at the wall, which act as a type of pressure release. A child temper tantrum is also a form of acting out when they don't get their way with a parent. Self injury is a third type of acting out in which physical pain acts as the substitute for that which a person cannot stand to feel emotional. Blocking inhibits thinking temporarily, may include affects and impulses, resemble repression, except tension felt, often happen in embarrassing moments. A student is unable to recall the fact needed to answer the exam question, although he recalls it as he walks out of the exam. In the middle of the conversation, a woman pauses, looks confused, and asks what she was just talking about. Hypochondriasis transforms bereavement, loneliness, aggressive impulses into self-reproach, pain, somatic illness, avoid responsibility, circumvents guilt, affliction due to ego-alien nature of introjects, identification, crucial to ego development, but person may identify with the love object to defend against anxiety or pain, real or threatened. Person adopts quality or symptom of one about whom feels guilty, identifies with aggressor. Introductions. Unconsciously simulating behaviors of someone who is perceived to be more powerful. Conscious patterning is referred to as imitation. Example, children taking on behavior and attitudes of their parents. Passive aggressive behavior expresses aggression indirectly through failures, procre- procrastination, illness that affects other more than self, indirect way of expressing aggression, seen in individual with borderline personality disorder. Example, an office worker shows up late to work every day after having a conflict with manager. Projection attributes own feelings to another due. to intolerable feelings or painful affects. In psychosis, becomes frank delusion and persecution, attributing unacceptable feelings, desire, or thoughts to someone else. Associated with paranoid personality disorder. Example, a man who had an extramarital affair accuses his wife of being unfaithful. Regression. When adult defense mechanisms stop working for us, regress to uh, we regress to personality we had at childhood. Attempt to return to earlier functioning to avoid tension at current level necessary for creativity. When the child is born, the older 4-year sibling start having temper tantrum or demands breast milk as well. Schizoid fantasy retreats autistically to avoid intimacy, obtain gratification. Somatization converts psychic derivatives into the body symptoms. Desomatization, infantile somatic response is replaced by thought affect. A student gets a headache while taking an exam. A woman feel uneasy, nauseating before asking someone out on a date. A man who witnessed a traumatic event becomes blind. What are neurotic defense mechanisms? They are controlling displacement, dissociation, externalization, repression, inhibition, intellectualization, isolation, rationalization, reaction formation, sexualization. So, what is controlling? Manage or regulate environment excessively to avoid anxiety. What is displacement? Shift an emotion or drive from one idea or object to another. Permit symbolic representation of less distress. Instead, when the target of emotion or drive changes to a substitute target. A recently disciplined employee yells at his wife instead of his boss. A woman watching a movie featuring love scene with a handsome actor goes out and seduces an unattractive man. What is dissociation? Drastically modifies personal identity or character to avoid emotional distress, including fugue state, hysterical conversion, DID, drug highs, religious joy, a feeling of disconnection from a stressful or traumatic event allows individual to block out mental trauma and stress by removing themselves from an uncomfortable situation. Example, a boy who experienced sexual abuses stare at the wall and daydreams whenever confronted with traumatic memories. Externalization perceives in external and object elements of one's own personality, including impulses, conflicts, moods, attitude, and style of thinking. Repression. The person forces the unacceptable or threatening feeling out of awareness to a point where she becomes unaware of it. Examples could be a simple uh, reprimand or as serious as a rape. A person is asked, how do you get along with your mother? And he responds, just fine, as he turns pale. Negative feeling about the mother are so unacceptable that they block his awareness. Isolation. Splits or separates idea from affect. Represses affect may remove one from object relationship, separating an event from the emotions that accompanying it. Example, a woman who experienced a warp attack recounts the incident in a matter-of-fact manner. What is inhibition? Inhibition or renounce says ego functions consciously to evade anxiety arising out of conflict with impulses, superego, environmental forces, or figures. Intellectualization avoids affective expression, experiences, relationship, attend to external reality to avoid feeling, and details to avoid whole. Using information and fact to avoid dealing with unpleasant situations. Example, while a patient is dying on the operating table due to an error, a surgeon calmly explains the technical details, complication of the procedure to the student. Rationalization occurs when we tell an element of truth but deny the larger truth of the matter. For example, I could have won the race, but the track was wet. The larger truth was that someone was faster. I got fired, but the boss was jerk. Failures are a threat to the ego. Rationalization doesn't hurt as bad. Reaction formation transform an unacceptable impulses into its opposite. It frequently used early can become obsessional character traits. Example, a person intrigued by certain ideas becomes a strong, outspoken voice against those ideas' action. What are the mature defenses? Altruism, anticipation, asceticism, humor, sublimation, suppressions are mature defenses. What is altruism? Performing acts that benefit other in other order to vicariously experience pleasure may help individual in avoiding negative feeling. Example: a cruel chief executive officer regularly donates charity organization. Anticipation anticipates plans for future inner discomfort that is goal directed. Careful planning or worrying and premature but realistic effective anticipation of dire and potentially dreadful outcomes. Asceticism eliminates pleasurable effect of experiences, uses moral to assign values to specific pleasures, derives gratification from renunciation of all consciously perceived base pleasures. Taking refuge in a remote mountain area after a disappointment, cancelling any responsibility of giving up that idea. Humor permit overt expression of feeling and thoughts without personal discomfort or immobilization and does not produce unpleasant effect or on others. Person may focus tolerate what is too terrible to be borne, but however does not allow feeling of the effect at all. A man, for example, a man with sleep apnea makes joke about his continuous positive air pressure mask. Sublimation. Satisfying one's wishes or impulses in a socially acceptable manner, channeling rather than preventing them. Example, a childless elderly man who always wanted to have children spend a lot of time teaching his nephews soccer. Suppression. The person is aware of the unacceptable desire and validates it but intentionally tries to keep it from expressing itself. For example, I know I am an alcoholic, so I am going on the vegan. A homosexual who intentionally does not date members of same sex so that the unacceptable does not express itself. An introvert is conditioned to be an extrovert. He often suppresses anger. Which defense mechanism do you use most? Rationalization, regression, repression, denial, submission, and projection. Remove defense mechanism by reading about them, writing about your feeling, actions, taking to close friend or therapist. meditating, praying, EFT. Name the defense mechanism. Bill Gates tells you your reply is illogical and you reply you are logical one. I'm smarter than you anyway. Cheating on my taxes is no big deal. Everyone does it. So these are the defense mechanisms. Uh, Thank you.